But we're still waiting for the Prime Minister to arrive. Let's go back now to Tova O'Brien at Parliament. And Tova, how urgently is the government treating this case?
Good evening, Mike. With extreme urgency, and actually we're just seeing the Prime Minister, Ashley Bloomfield and Grant Robertson walking into the Beehive Theatrette right now, but we saw it with that mad flurry, the Prime Minister and her senior ministers flying straight back into Wellington, those back-to-back briefings, 2 urgent cabinet meetings, and that's because just last week the Prime Minister was saying given the Delta variant, we could see the country, if there is a community case, we could see the country moving into an alert level 4 lockdown in a matter of hours. So this is being treated with extreme urgency, and I think finally now the country's about to find out what's going on, because there are a lot of questions. We were told about this a lot sooner than usual, but we weren't given
we
a
will
lot
leave
of
it there
detail.
because we're getting the
So
answers right now from the Prime Minister. Let's cross to that news conference now.
Good evening, everyone. As we advised earlier this afternoon, we have a positive case of COVID-19 in the community. We will not be in a position to identify if this is a case of the Delta variant of COVID-19 until genome sequencing is returned tomorrow. However, every case we have had in MIQ recently has been the Delta variant of COVID. And Delta is surging around the world. While we cannot confirm it yet, we need to assume that our case will be too. And that has shaped all of the decisions we have made this afternoon. Public health officials have been working at pace this afternoon to gather information on the case and their movements, and I will pass to Dr. Bloomfield shortly to set out the facts as we currently know them, including locations of interest that have been identified so far. But first, I want to assure New Zealand that we have planned for this eventuality and that we will now be putting in place that plan to contain and stamp out COVID-19 once again. Going hard and early has worked for us before. While we know that Delta is a more dangerous enemy to combat, the same actions that overcame the virus last year can be applied to beat it again. I'll now pass to Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So just to update you on the details around the community case that we announced this afternoon. To recap, just after midday I was alerted to a positive COVID-19 test result in Auckland. This case was identified when the person presented to their GP yesterday, Monday, with symptoms and was tested. So, to start with, I want to thank both the person who has tested positive and, of course, the general practice. We can only act on cases if we know they are there as soon as possible. The case is a 58-year-old male from a household in Devonport on the North Shore of Auckland. He became symptomatic on Saturday, the 14th of August, so the infectious period is considered to have started on Thursday, the 12th of August. Importantly, and this has been fundamental to our advice to the government, at this point there is no obvious link between this case and the border. Whole genome sequencing is being rapidly carried out at ESR's Auckland laboratory for this case, and we expect to have the results through in the early hours of tomorrow morning. The whole genome sequencing will help us learn about this infection and whether or not it is confirmed to be one of the Delta variants we have seen overseas, and it should also give us information about potential links to other cases. You will be aware that every case that we have in New Zealand in managed isolation, the sample goes to ESR for testing, for whole genome sequencing. That's not always successful, but we have a database, of course, of all the previous ones that have been sequenced successfully. So it will help us with our source investigation. In the meantime, as the Prime Minister said, we are assuming this is the Delta variant, as all of the genomes sequenced over the last at least 3 weeks, and in fact all but one since late June have been Delta variant. The person lives with his wife, who was also tested yesterday, and yesterday returned a negative test. Both individuals have been self-isolating at home until this point. On their earlier movements, the couple travelled by private vehicle on Friday the 13th of August to Coromandel Township. and stayed the weekend there, returning to Auckland on 15th of August. The case has a small number of workplace contacts who are isolating and being tested. The man is not vaccinated, but was in the process of actively booking his vaccination, had trouble with the website, but had been making efforts to do that. His wife is fully vaccinated. I do want to commend the case for being a frequent user of the New Zealand COVID Tracer app, and this tool has helped very much in helping us speed up identifying locations of interest. We have identified at last count 23 locations of interest, 13 in and around Coromandel Township and 10 in Auckland. I have 5 of those which I'll just run through now. These and any subsequent ones that are confirmed will be added to the Ministry of Health's website. These 5 locations are all around Coromandel. Importantly, the Star and Garter Hotel in Coromandel on the 13th of August, between 6:39 and 7:40. The Umu Cafe in Coromandel on the 13th of August between 7:40 p.m. and 8:30 p.m. The Star and Garter Hotel in Coromandel on the 14th of August, that was the Saturday, between 7:11 p.m. and 9 p.m. The BP gas station in Coromandel on Saturday the 14th between 9:30 a.m. and 9:40 a.m. and Terrace Beads in Coromandel on the 15th of August between 10 a.m. and 10:05 a.m. The instructions for anyone who has been at those locations of interest at the time specified is to immediately self-isolate and call Healthline on 0800 3585 453 for advice about what to do. These locations and others will be on our website, as will be clear instructions about what people are required to do. Now, I should say that there will be people from outside of Auckland and Coromandel who may have visited and have been at these locations of interest, the ones that we've identified and subsequent ones. So it's important for anyone who has been in these locations over the last week to check our website and see if they are included. If you are, wherever you are in the country, you are required under a Health Act Section 70 order to follow the instructions around isolation and testing. There will also likely be locations that are en route between the Coromandel and Auckland, so once again, do keep an eye on that information on the Ministry website, and we will publish it as it becomes available. Further interviews are underway to help establish how this case was infected and further details on his movements. I understand people will be concerned, however, I do want to assure people, both in Auckland and Coromandel and indeed across the country, we are taking the necessary actions immediately to limit the spread of the virus. Our systems have already swung into action to gather up the facts. An important action from here is that we identify, of course, any other potential cases that are out there. So there are testing centres open across metropolitan Auckland until 8 p.m. tonight, so extended hours. All testing locations nationwide are available on the HealthPoint website. There will be additional testing centres across Tamaki Makaurau tomorrow, further details, and likewise we're wanting anybody around the country, if they have symptoms at all, to be tested, so all DHBs will be ensuring there is good testing capacity and that is accessible, including extended hours right across the country. The most recent wastewater testing result for the North Shore was on the 11th of August, and that was negative. A sample taken yesterday is being analysed presently, and we will have the results tomorrow. Daily sampling will now be undertaken, and ESR is looking at options for sampling around Coromandel. Additional public precautions, particularly around visitors, will be in place, of course, in relevant hospitals. So this case was identified in Auckland, but it is a national issue. Because we cannot link the case to the border at this point, it is possible there are other cases around in Auckland and other possible chains of transmission. People from around the country will have travelled to Auckland and back to other parts of New Zealand. Therefore, whilst it's a case identified in Auckland, it requires us all to be part of the response. Hard work from everyone across the country will help us get on top of this outbreak. There's been a huge amount of work already over the past few hours by teams here and in Auckland. There will be people working into the night to carry on that response. But the health system cannot do it alone. As always, it is together that we will make a difference. Back to you, Prime Minister.
Thank you, Dr. Bloomfield. As I said, we are assuming that we have a case of Delta that we are dealing with. International evidence and science around the Delta variant of COVID-19 shows that it is potentially twice as infectious and more liable to cause severe illness. As Professor Skegg's report set out last week, with Delta raging around the world, it was experts' view that it was not a matter of if but when. As it is, we are one of the last countries in the world to have the Delta variant in our community. This has given us the chance to learn from others. And while this is a situation no one wants to be in, there are benefits to being amongst the last. We are in the position to learn from experience overseas and what actions work and what actions don't work. On that front, Delta has been called a game changer, and it is. It means we need to again go hard and early to stop the spread. We have seen what can happen elsewhere if we fail to get on top of it. We only get one chance. That's why Cabinet has met this afternoon and made the decision that New Zealand will move to Alert Level 4 from 11:59 p.m. tonight. Level 4 will be for an initial period of 3 days, except for Auckland and the Coromandel Peninsula, who we anticipate will likely be at Level 4 for 7 days, due to them being most closely linked to our current case. Over this time, we will be looking for testing results from people from locations of interest, wastewater testing, and general community testing of those with cold and flu symptoms elsewhere in the country. Our plan over the coming days is assess if there are undetected chains of transmission elsewhere to track down the source case and to assure ourselves that there aren't other cases in the community elsewhere. We have made decisions on the basis that it is better to start high and go down levels rather than start too low, not contain the virus, and see it move quickly. We've seen the dire consequences of taking too long to act in other countries, not least our neighbours. Just as we successfully stayed home and saved lives last year, I'm asking the team of 5 million to unite once more to defeat what is likely to be this more dangerous and transmissible variant of the virus. Now I want to come back to what Level 4 involves, given it has been a year since we used this, the highest alert level that we have. The underlying principle for Level 4 is reduce down contact between people to a bare minimum, essential contact only. That means the simplest thing New Zealanders can do to stop the spread of the virus is to stay at home. Beating Delta means lifting our game. Delta spreads more easily via the air, so physical distancing is even more important. As we've seen overseas, particularly in Sydney, unnecessary trips outdoors have spread the virus and mean communities have not been able to get on top of it. So I ask New Zealanders to please follow the rules to the letter. Let me quickly expand on each of the reasons for leaving your home briefly and some of the common questions that you might have. The reasons for leaving your home under Alert Level 4 include physical exercise in your neighbourhood, visiting the supermarket, dairy or pharmacy, necessary medical care, or getting a test. And if you undertake these activities, please wear a mask when you leave the house. Let me expand in a little more detail on each of those reasons for leaving your home. People in the past have asked if they can leave their home for a walk, for instance. Yes, you can. Or to take your children out on their scooters, for instance. But we ask people to stay 2 metres away from anyone you pass. Stay local and do not congregate. Don't talk to your neighbours. Please keep to your bubbles. It comes down again to those very simple principles. We know from overseas cases of the Delta variant that it can be spread by people simply walking past one another. So keep those movements outside to the bare minimum, wear a mask, and make sure you keep up that physical distancing. The bubble is back. The people in your bubble should be the people in your immediate household or those dependent on you. Once you go into a bubble, you must stay in it, and others cannot join. That risks spreading COVID. If you are completely isolated or you live alone, remember you can join a bubble with one other person that you have contact with. It needs to be just you and that person, though. You must be faithful to them, and they must be faithful to you. Those in those circumstances will remember those rules from our last level 4. If you have multiple contacts with others, that is where the risk increases, and we cannot afford that. You can drive locally to your supermarket to get food, but again, we ask that you maintain your physical distance, again, to 2 metres from others who may be undertaking essential errands, and again, please wear a mask. Other than that, we're asking people to stay home. Only shop when you need to. And it is preferable that there is just one person per household that goes shopping to reduce any risk of spread, and that they follow the instructions of staff. Remember to always act like you have COVID-19. Stay clear of others. Don't put them in harm's way in the same way you'd expect that they don't put you in harm's way. There will be economic support available, and I will ask Minister Robertson to outline the available measures at the conclusion of this first introductory press conference and questions. On vaccinations, we will be suspending vaccinations for 48 hours while we ensure that vaccinations are unable to take place in a safe environment, both for our vaccinators and those who may be visiting. We have currently 40% of our eligible population vaccinated with at least 1 dose. We want that to continue safely, and when we can, we will. We will provide a further update on that in the next 24 hours. I want to finish by acknowledging our frontline workers. The most important thing we can do to acknowledge their work is to only leave home for the reasons that I have described. I know that one of the worst things about COVID-19 is the absolute uncertainty that it creates, but we know more now than we did a year ago. We know that this strategy works. We know that we are a strong team of 5 million, and we know that life will get easier. We just need to keep going. We'll both be back tomorrow at 1 p.m. to provide you with an update of all of the information that we have. Till then, please take care and please be kind to one another.